Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm very pleased today to be talking with Dr. Len Fromer, a family physician, who, let me just say a bit about Len. I've gotten to know him over the years. He is a family physician par excellence. He worked in, built a large practice over the years, and then kind of found his way into a very intriguing job. I think of him as a kind of family physician pioneer. But before he did that, he was president of the California Academy of Family Physicians and has worked very hard to support the family medicine movement. Currently, he's president of healthcare initiatives for Turner Impact Capital in Los Angeles, California. Len, thank you very much for joining with us today.
My pleasure, Larry. It's great to be with you again, and really excited about the audience that we have at the Innovators Network, and giving the message that we can make a difference. We can do something with primary care that's really innovative and will matter in communities.
Wonderful. So and when I say that you're a pioneer, I don't know too many family physicians with hundreds of millions of dollars to invest in care of the underserved. So why don't you give us some background on your organization and how this all works?
Happy to do that. And let me just share the screen here for a few minutes and let you see what we're all about. So the DNA of our company goes back about 25 years. Turner Impact Capital is a family of 3 interconnected but somewhat independent vertical investment funds with a similar mission. And the mission is to address the social impact issues, challenges that people face in their lives around education, housing, and healthcare. Our first foray, as you see in this timeline here, 25 years ago or so, was really in an underserved community in Harlem, New York, that our principals and our leaders who founded the company put together a investment fund that was able to take a closed down, I believe, factory there and turn it into this terrific, thriving piece of an underserved community to serve the residents and address some of these really big challenges that we face in American cities. And that starts to unfold the mission we have, which is really particularly around underserved communities in urban dense population areas, and to target communities that are low to middle, low to median economic status, racially and ethnically diverse, and in the healthcare fund, either medically underserved area designated or health provider shortage area designated. The mission is to focus on, in our fund in healthcare, focus on those areas where we can support the development of primary care infrastructure, community facing. We don't do inpatient, we only do outpatient facilities, and work with clinical partners to develop and build what people need in those communities. And as you see in this timeline, we have our longest standing funds, our charter public school funds. We now have built 120 charter public schools in those underserved communities around the country. Our second fund, as pictured here, is a multifamily impact fund. We own and operate about 12,000 units now, and it continues to grow, of multifamily housing, same targeted communities. And our newest fund, our baby, my fund, is the Turner Healthcare Facilities Fund, which really started in 2017. We raised enough capital to be able to build about $400 million worth of primary care facilities in those same communities I mentioned, same characteristics. To this date, we have now, I believe the current number is 26 facilities that we have either already opened or are in construction, or we have term sheets in place for upcoming construction, and then we have a long pipeline behind that. What is common to all of three funds is that we have synergies where we, for instance, the teachers who teach in the charter public schools live in the housing communities that are nearby, and the healthcare employees, staff, and even leadership of those healthcare organizations we partner with in the healthcare fund live in those housing communities. We try to bring curriculum into the schools about health literacy and about healthcare professions opportunities and so forth to expose the students in those schools to that. And there's staff in those schools who work in what we call our community enrichment facilities in the housing fund. Put it all together, we are a family of vertical investment funds. We raise money to bring capital into the communities, the matching communities that all three funds approach. The really important activity that happens across the funds that makes a difference in the communities and is exemplified here by the value proposition we bring to healthcare is that we have a mission-driven ethos in our company. We are a very diverse company of employees with a mission-driven culture that's all about partnering in the healthcare fund with clinical facilities, clinical operators, clinical organizations who require the infrastructure to bring care to communities that usually don't see it, particularly primary care. And you see here a bulleted list of things that really make that a reality. And the important aspect of this that I want to just focus on is we're a turnkey solution for those organizations, those clinical organizations. We will hand the keys to an organization that we partner with to provide 100%, up to 100% if they need it, of the capital to build that facility. And the model is incredibly unique and simple. And as you see, it's partnered with environmental responsibility, an opportunity with defined terms, very reasonable and fair terms as a bridge to ownership of the facility for our clinical partners. We can get into some of the details around that as Larry and I talk in the next few minutes, but it's all about a nationwide, as you see here, group of people that we have on our team that is placed throughout the country to bring everything from the real estate expertise needed, the zoning and permitting and entitlement expertise to work with municipalities and jurisdictions to get the job done, to be able to open the doors, to take all the headaches of all of that away from the clinical partners we operate with. And we can get into the model, but the key bottom line is it's a fully transparent model that really is based on the total project cost of what we build, with every line of the budget being visible to everybody involved in the project, and taking that and turning it into a long-term lease to return the capital and return to our investors. That's at the most basic level what we do. I will stop there and let me go back to Larry and let him ask me questions. So I think he'll be really good at bringing the picture to the forefront of why this Innovators Network is so special to us and to me to bring this message.
So Len, could you speak to where you get your money from? When you say you go out and raise a few $100 million, where does that money come from?
Our investors run the gamut from high net worth individuals to banking institutions, to university endowment funds, to foundations, to union health and welfare funds, pension funds. They're organizational or individual people all have a common belief in mind, and that is philanthropy is great, but it only puts Band-Aids on problems. Government grants are great, but they're going to run out at some point. What is most obvious is if we really want to scale a mission, in this case, bring primary care excellence to underserved communities, we really want to scale that around the country and grow it, we need a market-driven model. And we have proven through the last 25 years that whether it's education, housing, or healthcare, we can do that with risk-adjusted returns that the investors seek, and that it can be done high quality in a for-profit mode to bring excellence and value in healthcare delivery to those same communities.
So I'm aware that within the not-for-profit world, where at least most academic family medicine is housed, there are some very, very strong biases against for-profit entities. Venture capital has been known to come in and destroy some pretty amazing innovations. So you folks have to make money. So how do you make money? I mean, you don't just give this money away that the investors have invested in you. What's their expectation of a return, and how do you manage that expectation?
Yeah, Larry, you just nailed it. You said, you brought up exactly what we face in convincing the markets that you can do this, you can make money, and you can do it in a way that does not cost more than the model that's in place now for healthcare and driving healthcare infrastructure delivery. Good example. It is surprising to most people to know that when you build a facility for primary care delivery in the community, the percentage of the revenue stream that facility will generate from seeing patients and doing patient care, the percent of that revenue stream that goes towards the real estate cost, all in our model. So you've got the cost of the land that we purchase and we become the landlord in, that long-term lease for return of the capital with the healthcare provider being the tenant. But the cost of the land, the cost of the construction, hard and soft costs, the cost of everything included in that transparent budget, when you put that all together, it comes to only between 3 to 5% typically of the revenue stream. That's an amazingly low piece of overhead. Think about primary care, and anybody in the audience who's listening to this in the Innovators Network, if you've been involved in those numbers and looking at those spreadsheets, where does overhead come from? Well, the largest chunk of overhead is clearly the cost of the personnel, right? Not just the support teams, but the cost of the primary care providers in the organization, the doctors, the PAs, and nurse practitioners, right? And the support teams, front and back office personnel. The real estate cost is 3 to 5% typically. It doesn't go above that in our model. So you can do this in a for-profit model and do it efficiently and have transparency in every line item of cost in the budget and bring it home so that I can hand you the keys on a new facility, knowing what the rent's going to be, knowing you can purchase that facility at a pre-agreed upon price driven again by only that construction budget, that total budget, and give a decent return to the investors. It's not automatic, and it's not true at all that a for-profit model done the right way, done transparently, means that it's going to cost more.
So in 2019, when we held our meeting in Lancaster, Pennsylvania, Alan Roth, Dr. Alan Roth, a family physician who's chair of the Department of Family Medicine at Jamaica Hospital in Queens, safety net hospital serving a very, very underserved population, and always struggling for capital, especially for a new build. He heard your presentation, and you and he entered into a conversation. Do you want to talk a little bit about where that conversation is headed?
Happy to talk about it to the extent I can. There's some confidentiality issues because there are other parties involved in the discussion, but I can talk in general terms about how we have moved that needle forward. They are doing tremendous work at the organizational level at Medisys, which is the organizational level of Allen's Hospital, Jamaica Hospital Medical Center. The organization is doing tremendous work in improving primary care and bringing primary care, advanced primary care, to what is admittedly, and I think the data will prove it, the most diverse county in the world, literally in the world. Ethnicity, racially, Queens, New York, very diverse county. Jamaica is a great example of a county that's been really devastated by the COVID pandemic. And what they had to live through there was just the center of the storm in terms of the surge that New York experienced a year ago. Allen has a vision to transform primary care even further in that catchment community of Jamaica by building out, having the infrastructure of an integrative care center. The estimated size of that integrative care center is somewhere around 80,000 square feet. It'll be in Jamaica. That's an estimate that can be scaled up or down somewhat depending upon the programming that's chosen ultimately to put in there. But as an example of our model, we took that to our design folks. We took that to, Allen had worked already with an architect to kind of lay out modules of what would be presented in that facility. And I had my real estate people do a search most recently, actually a few weeks ago, conducted a search of what parcels are available in that area that would fit where Allen and his team wanted to have the facility. And we are going, I believe it's the end of this week, to go over all of the options that came up that are available, that we can purchase, my fund can purchase the land, and then work through the creation of a long-term lease with Allen's organization to be the tenant. And in the long term, I'm talking about 15 to 20 years with 2 5-year options, with a purchase option should they want it several years into the project, if they want to purchase a facility based on all of that, the lease and the purchase option on the total budget of the project. What we can do in the end is be able to build with that capital that we have, that integrative care center, so that they have an infrastructure to deliver the great model of care that Allen Roth and his team have put together and continue to evolve into a really advanced primary care model.
So I just want to say it's very exciting to see, and I know these kind of projects don't happen overnight. It takes a lot of problem solving. One of the key elements is having the capital, which thankfully you have, but I know you're looking for other partners. And so if there are people listening to this who are interested in talking with Len and his company to explore the possibility of developing a partnership, developing a relationship, please contact me. I'll be happy to put you in contact directly with Len. And it's so exciting to see how far things, it's 2 years, but still this community is that much closer to getting a service that can improve the health of the population. So Len, I'm going to bring this portion of our presentation to a close here. And for the audience, Len and I will be available. I'll actually be in the room, but Len will be available via Zoom for a question and answer and further discussion. So Len, I want to thank you very much for taking the time, and really thank you very much for the work you're doing.
Well, my pleasure, Larry. Thank you so much for asking me to do this piece of participation in the Innovators Network. Really exciting. Look forward to the questions from the audience.
Thanks very much.